Marcy Blakeney just aged out of her parents' health care plan, and for the first time ever, she is responsible for her own coverage. Marcy navigated healthcare.gov but was uneasy with all the new terminology. Deductibles, premiums, copays, and out-of-pocket costs can confuse someone who's never dealt with insurance.
You don't feel confident when you're not sure what you're about to step into and pay for each month.
She spent hours on the phone talking to familiar insurance companies and still felt uncomfortable with the choices she was given.
It became pretty tedious and long process.
A friend told her about Benefinder.com. Benefinder's founder, David Blanchard, used to work for an insurance company. When the Affordable Care Act passed, he knew the uninsured were going to need help.
I saw a lot of people try to find insurance under the new law and struggled with ways of comparing their plans and finding the best value.
His unique analysis software simplifies the process. Enter your zip code, who needs coverage, and a few other personal details, and you'll get all the available plans laid out so you can compare the total cost of the policy, not just the deductibles. This graph shows a $3,000 difference between similar policies.
And ensure that they're getting their potential subsidy, the best price, the best lowest total cost, and also get them enrolled.
David explained the lingo to Marcy, crunched her numbers, and found a plan that fits her needs and her budget.
And it was all free. Free for him to help me and basically do everything on my behalf.
I'm Jennifer Warnick with more Bang for Your Buck.
Hi, my name is Susan Combs, and I'm an insurance broker for Combs & Company. About Cobra is self-employed health insurance. So what Cobra is it's an extenuation of the coverage that you had with your previous employer. So a lot of times when somebody is becoming self-employed and they're starting their own company, they're trying to cut costs as much as possible. So if they had worked for a very large company beforehand, having the health insurance extended through Cobra might be your best bet and the most economical. But sometimes if you're working for a smaller company or say a company that's not in your local state, it might not be the best rates. So you want to take a look and see what else is out there as an individual and see if you're able to have just as good health insurance or better cost insurance and see if doing the Cobra is the best way to go. The one thing you also want to keep in mind is since Cobra is the extenuation of the employer's insurance, the tax deduction, deductibility is going to be different because technically you're still on their group plan. So you want to talk to your CPA because it might not be a tax write-off as it would be if you have a self-employed health insurance plan. So the best thing to do is to consult with a broker, shop around, see if there's going to be something else that's going to be better than the Cobra, and inevitably it might be the best option for you. And also talk to your CPA and see how it's going to affect your bottom line if you're going to take Cobra versus taking your own health insurance as an individual.